Hysterosalpingography. Imaging is there now everywhere, like in your clinic. You don't have you're a gynecologist, but in your clinic you don't have the facilities for a laparoscope. But why you go for direct for a laparoscopy, pelvic laparoscopy? No, you do ultrasonography, you do hysterosalpingography. Major part of any pathology is there. Then you can find. And hysterosalpingography for sterility couple, you just give on first day you don't prescribe, but you write in your prescription. You give them some medicine to prepare. You take the menstrual history, and then you tell that you and any sterility couple. What I do is that I ask the lady to maintain a menstrual calendar. What time the menstruation occurs, date, and how many days it is, how many pad changes are there. So you can say 2 days. Quarter pad paltao. How many pads do you change? They'll say that I am changing only one. Still now, in the urban and rural and villages in the cities, in Kolkata even, all are not using sanitary napkins. So they are using some cloth. It is a common this thing. Jitna slogan hota hai, because due to many incumbencies. So, but you request them for 3 months at least to use sanitary napkins. Actually, what we were discussing is that any sterility couple comes to you for any patient, you take a detailed history. A history will give you many clues. Clinical examination, a must, and investigation. Now, if on first day, you have thyroid profile, all hormonal profile, all CRP protein. I don't know what is CRP protein. How much significance is that? And if you read the report, hote hobe na, you are in a, the report will push you into a dilemma. কোন যদি সিআরপি প্রোটিন বেড়েই যায় তাহলে তোমার কি ট্রিটমেন্ট মোডটা কতটা বদলাবে আমি বলছি বেসিক্স ফার্স্ট you can go for a group hemoglobin CBC just these 2, 3, 4 tests you can now menstrual history for it may be any woman comes to you. It might be abnormal uterine bleeding, menorrhagia, dysmenorrhea, prolapse. You take a history and then go for the investigation. Now, if it is a sterility couple that we were discussing, you go for an USG. You note it. On the first day, don't say it a photocoded yes or a coded yes or no. And hysterosalpingography. You ask her the menstruation, but at the day she's presenting herself to you, you take the menstrual history, any like pain during menstruation, or she is dyspareunia, that is pelvic pain and vaginal pain during intercourse. So during the intercourse, they have gone into the peak. Now the male is trying his best, and suddenly she pushes the male, or lives no, amar batha hocche. So that lady has to be you have to do a counseling, and the husband should be also you ask questions and you tell them to go slow. This is one factor. Second thing, like in my prescription, what I do, means I have modified, আমি তো স্কটল্যান্ডের ডাক্তার নই, আমেরিকার ডাক্তার নই. আমি গ্রাম বাংলার ডাক্তার, ভারতবর্ষের ডাক্তার। তো আমি লিখি ইচ্ছা আলাদা আলাদা করে। হাজব্যান্ডকে যখন দেখছি আই examine him, he might be a small testis might be there, some undescended testes might be there. Both testes are undescended. And similarly, even the woman now in during how many years marriage? বলছে 2 বছর, কেউ বলছে 6 মাস, 6 months. Now 6 months একটা রিলেশন তৈরি হয়ে সঙ্গে সঙ্গে ইন্টারকোর্স হয়ে যাবে, বাচ্চা হয়ে যাবে। People are expecting. People means who? Relatives, friends, or whatever it is. হ্যাঁ, ও 7 বছর বাচ্চা হয়নি আমার, তো সবাই আমার বউকে দোষারোপ করছে। The woman is hung. ফাঁসি কি? হোয়াট? শি ইজ নট, বৌমার বাচ্চা হচ্ছে না, 7 বছর বাচ্চা হচ্ছে না, তাহলে কি হলো? মানে সবাই চিন্তিত। তো ইউ হ্যাভ টু গিভ আ গুড কাউন্সেল অ্যান্ড ইউ সেপারেটলি consult with the male part and the female, and then you bring them together and tell them that কোনো চিন্তা করিস না, এটা হবে। কে বলছে হবে না? Now menstrual calendar you have to ask and get the date, timing. You tell them that you buy a small notebook. Most of the nowadays education তো প্রাইমারি এডুকেশন তো হয়ে গেছে অনেকের, স্কুলিং 10th ক্লাসে হয়ে যাচ্ছে, কলেজে হয়ে যাচ্ছে, কিন্তু তারা এটা ইগনোর করছে বা তাদের মাথায় নেই, বিকজ দে আর নট বিং taught. Now one thing I tell you, that you have to speak in the feeling and emotional content. ওই খাস 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 করে টেস্ট করে দিলাম, ওষুধ লিখে দিলাম, এই দিলাম, ওই দিলাম, এই দিলাম। It is not that. Even you have to teach them in small sentences that what they should do and how they should have an intercourse. এগুলো local, your own, you have to question them, answer, you tell them you do this. Maintain a calendar, menstrual calendar, 1 day, 1 date. Then you can track that how many days. Is it a oligomenorrhea, or it's a dysmenorrhea, or menorrhagia, or how much pain is there, and dyspareunia. Because in the highest peak of the intercourse, suddenly the woman cries or shouts, no, chhad dao. Now what happens? The husband leaves. So that is you can say that suddenly everything is disturbed, mental disturbance, everything is there. এটা যদি হয়ে থাকে তাহলে তোমাকে সেটা womanকে বোঝাতে হবে, you have to tell them that you have to do this. And menstrual calendar, now why? For fixing up the date, that in which date they'll take the diary to the your imaging center, and they'll say আমার মেন্সের এই ডেট, তো 10 থেকে 12 থেকে 13-14 মধ্যে। কারণ why we don't do an hysterosalpingography? Because the dye is pushed within the your uterine cavity. So if she is conceived but she is not tested the urine, that means that gets disturbed. This is one thing. Second thing is that you have to know uterus is in many forms, at least somewhere there will be a question on uterus, supports, or your what is the shape, what is the clinical orientation, what are the embryological consequences of the congenital defects of the uterus. This is very common question asked, and antiversion, antiflexion, retroversion. These small words, small 4 marks, 10 marks, according to the question you have to answer.